Hello everyone, I am Dr. Rashid Hassan, the founder and CEO of DentoScope. Uh, Today's lecture is about the artificial teeth, which I'm going to share with you just in a few moments. So, uh, today's topic is rather quite a small one, but still it is very, very important if we keep in mind the university questions. Uh, Although it seems quite simple, but there are concepts that need to be cleared uh, when you go through this topic. Okay, let's get started. So, first of all, the desired properties of artificial teeth. What exactly are the properties that any technician or even patient they desire from the artificial teeth that they use for certain procedures like for crown and bridge and also for the uh, complete dentures as well as for the partial dentures, both cast partial dentures and the acrylic ones. So first thing is the aesthetics. Well, aesthetics is the main concern for the dental technician as well as the dental surgeon and even the patient. Their main concern is that their natural teeth color and the artificial teeth that they will use as a denture, well, the color should match with each other. So aesthetic is the main ideal property that we look for in any of the artificial teeth that we use. The second thing is the adhesion between the artificial teeth and the denture base. So, as the name suggests, that two types of artificial teeth are used most commonly. So there should be a strong adhesion between those each one of them and the denture base. So I'm going to go into the details of each single type of the artificial teeth that we use for the fabrication of any partial or a complete denture. So we will look at the chemistry as well. Then the compatibility with the denture base material. Well, the denture base material is basically the polymethyl methacrylate, which is acrylic. So even if it is an acrylic um artificial teeth or the porcelain one, they should be compatible with the denture base material. Then it should have a low density. It means that whatever material you use for the fabrication of the artificial teeth, it should not make the denture heavy. The denture should not be heavy. It should remain lightweight so it doesn't fall under the effect of gravity. So the density must be very low. Then resistant to fracture. Obviously, it should be strong enough to resist the occlusal forces and even uneven forces as well. So the resistance to fracture is one of the main property that we look for. Then the abrasion resistance. Well, for a long service life of any artificial teeth, it should be of topmost concern that it should be abrasive. It should not be abrasive. It should be resistant to abrasion. So whenever the patient he chews or bites or even anything like the mastication as well. So the artificial teeth must not be abrasive. They should not wear off. Their occlusal anatomy must remain constant for a longer duration of time. So these are the few ideal properties that we look for in any of the artificial teeth. So there are two types of artificial teeth that we use in dentistry. Number one is the acrylic teeth, and number two is the porcelain teeth. So both these types of artificial teeth, well, they are from two different groups. Well, let me tell you something that all the dental materials, they are divided into four main groups: polymers, ceramics, then there are composites and metals. These are the four main groups, and any dental material, any dental biomaterial that we are going to study, that or we know or we use, will fall in any one of these four groups. So here what we see that one group is the acrylic one, and the second group is the porcelain one, which is ceramic. So these are the two different types of artificial teeth that we use in the fabrication of any prosthesis. So moving ahead, let's see what acrylic teeth exactly are. A brief introduction about the acrylic teeth. Well, acrylic teeth, well, they are produced from reusable metal molds. There are certain metal molds of different sizes and shapes according to the artificial teeth that we are going to fabricate. Like anterior, there are different metal molds for the anteriors, cuspids, bicuspids, and molars, upper and lower separately. So we basically use acrylic to make those artificial teeth by any one of these two methods which are shown here. Well, number one is the dome molding technique, and the second one is the injection molding technique. Well, dome molding technique is basically a manual type of technique which is used to fabricate the acrylic teeth. We make the dough from the polymethyl methacrylate, and then we incorporate it into those metal molds. Then the second one is the injection molding technique. Well, this is a more accurate type of technique to fabricate the acrylic teeth because it is a mechanical one. Under high pressure, the acrylic is just injected into the metal molds of different sizes and shape to fabricate the artificial teeth made up of acrylic. So any one of these two techniques are used, and most commonly the injection molding technique is commonly used because it is controlled. You can control the pressure of the acrylic resin which you are going to inject into those metal molds of different shapes to make different types of teeth. And then the resin used in the fabrication of the acrylic teeth, well, they are highly cross-linked. As I told you that acrylic is a polymer, and the polymer is composed of many small units which are called as the monomers. The monomers, they combine and they form a large macromolecule which is called as the polymer. So acrylic is basically a polymer, and these acrylic chains are much more highly cross-linked. Well, they are intermingled, they're cross-linked much more than the denture-based acrylic. Well, then you can add the tooth-colored pigments into those artificial acrylic teeth. Well, if we see the shade guide, it has different shades, A1, A2, A3, B, B1, B2, B3, and so on. So different tooth-colored pigments are added at different points of time to fabricate acrylic teeth having different shades. So we can use different shades to match exactly with the tooth color of the patient. So that's why the tooth color pigments are added for the aesthetic point of view. Well, one thing must be kept in mind that even if the patient asks for a much brighter shade of teeth, but keep this thing in mind, they are not going to be aesthetically acceptable. Why? Because the natural teeth, let's suppose the natural teeth have a shade of B1, and the patient wants the artificial teeth of A2 or A1, much more brighter. But even if you give those brighter teeth, the brighter shade teeth to the patient, well, they are not going to look aesthetically good, because anyone can easily demarcate between the natural tooth and the artificial one. So main aim of the dentistry, the main art of dentistry, is that no layman should be able to differentiate between a natural tooth and any sort of restoration. So that's basically the main art of a dentist. So that's why we will only give those tooth colored shade which will match exactly with the natural teeth. Then moving along, the chemistry is basically the polymethyl methacrylate. As I told you, it is the same acrylic which is used for the denture base, but the only difference is here it is more cross-linked than the denture base, so they are much more stronger, much more harder as compared to the acrylic denture base, and that's exactly what we want, because these teeth are going to undergo the masticatory forces, the biting and chewing forces, so they need to be very hard and tough to withstand the occlusal forces. Now, a brief introduction about what exactly the porcelain teeth are. Well, porcelain is basically the ceramic. They fall into the category of ceramic. So these are basically the ceramic teeth. So chemically, they are very, very different from the acrylic teeth. Well, they are available in standard shape and sizes in the market, in the industry, and we can use as per our requirement. Now, moving towards the process, the molds, they also have the molds for the fabrication of porcelain artificial teeth, just like the acrylic one. But the molds of the porcelain teeth, they are 30% larger in size as compared to the normal size that the patient has. Why is it so? Because if you have some concept about the ceramics, you will understand it much easily. That ceramics, they undergo a process which is known as firing of porcelain, and after the firing procedure, there is a shrinkage, which is called as the firing shrinkage. So that's why the molds are kept 30% larger in size as compared to the original size that we want, because if you'll keep the mold size exactly the size that we want, then once they shrink, they are going to be much more smaller. So that's why, to compensate for the firing shrinkage, the molds are kept 30% larger in size. So once the porcelain is fired and then it shrinks, we get the normal size. So that's the main idea behind keeping these molds a bit larger in size. Then there are small holes or metal pins which are present at the base of the porcelain teeth. Well, that's the differentiating point from a student's point of view, that like in even in the oral examination, the viva, the examiner asks you to differentiate between acrylic teeth and the porcelain teeth, and both strips are present right in front of you. From just one view, you cannot differentiate. So the main differentiating criteria is you just pick one tooth out of a strip and look at the back side. Look at the base of that porcelain, the artificial teeth. If the base has some hole or a metal pin, then the tooth is porcelain tooth. The artificial tooth is going to be made up of porcelain. But if the base is plain, smooth, then it's the acrylic tooth. So that's the differentiating point from between the porcelain tooth and the acrylic one. Then, as we know that the porcelain or ceramic is such a hard material that it has the tendency to wear up the enamel of the opposite tooth. If there you have given it the partial denture in a molar region from a porcelain uh, artificial tooth, and in the opposing teeth there are natural teeth present. So when the patient starts to chew, after some time you will observe that the opposing natural tooth, well, they wear off, because it is such a hard material, the ceramic. Well, this table shows you some of the comparison of properties between the acrylic teeth and the porcelain one. We can see a marked big difference in the values of density, coefficient of thermal expansion, modulus of elasticity, and hardness. Just a comparison, you can see a lot of difference, and I'm going to explain it in the coming slides so that you can easily uh, you can easily understand the difference, why the difference is so much high. Well, the first and the most important point is they belong to two different categories of the dental materials. One is a polymer, the other one is ceramic. So they and ceramic is undoubtedly the hardest of all the restorative materials. So now let's compare a few of the properties of the artificial teeth. Well, we have two types of artificial teeth, the acrylic one and the porcelain one. Let's compare the aesthetic property. Well, well, both these materials, the acrylic and the porcelain one, they give a slight reasonable sort of appearance. Well, a slightly realistic one, but the porcelain teeth, well, they are much more realistic as compared to the acrylic teeth. They are much more closer to the natural appearance in the shades, hue, value, chroma, as compared to the acrylic teeth. The translucency and color of the porcelain is much better as compared to the acrylic teeth, and the variety of shapes, color, sizes, and shades are available for both these types of artificial teeth, the acrylic and the porcelain one. So you can choose from the shade guide. You check the shade of the natural tooth of the patient, and then you can easily select the shade, size, and shape of the any one of these any one of these artificial teeth. Then the second one, well, the clicking sounds, they are produced when the opposite porcelain teeth, they come into contact. So these porcelain basically is a hard material. So whenever it comes in contact, it gives these very, very specific clicking sounds. And in case of the acrylic teeth, well, they remain silent. There is no clicking sounds heard in case of the acrylic teeth. So that's also a difference. Then the now coming to the chemistry of the both of these artificial teeth, attachment to the denture base. How these artificial teeth are going to be attached with the denture base? Well, there are two types of adhesion which are seen here. One is the chemical adhesion, and the other one is the mechanical adhesion. Well, as I told you, that acrylic artificial teeth have the same chemical composition with the denture base. So the chemical adhesion is seen between the acrylic artificial teeth and the acrylic denture base, as both have the same chemical composition. So there is going to be a chemical adhesion between the denture base made up of acrylic and the acrylic artificial teeth. Whereas in case of the porcelain teeth, as I told you, that there are holes and pins which are present at the base of the porcelain teeth. Well, they are for the interlocking purpose, because they, as I told you, these both are uh, they both belong to two different groups. So what exactly they means that they cannot be chemically bonded to each other. To adhere them with each other, these small holes and pins present at the back at the base of the artificial teeth, well, they give the mechanism of interlocking. The denture base acrylic, it interlocks between the between the metal pins or holes and the denture base, and easily these two are attached with each other. So that is the mechanical adhesion. Chemical in case of the acrylic teeth, and mechanical in case of the porcelain teeth. Well, for a good adhesion, it is very compulsory that the wax used for the fabrication of the wax pattern, it should be completely boiled out. There should be no residual wax, because if there is going to be some wax, then the adhesion is not going to be proper. And it is a very common problem that 33% of all the denture repair is due to the debonding of teeth from the denture base. So during the fabrication of the partial denture, either it is the acrylic partial denture or the cast partial denture, it should be kept in mind that the complete boiling out of the wax is very important. Then, if we talk about the acrylic teeth, they bind more efficiently, effectively, more in a much better way with the heat cure acrylic denture base as compared to the self cure? Well, if you have some knowledge about the types of denture based material, one is heat cure denture based material, then self cure denture based material, then thermoplastic, microwave cured, light cured. So these are the 5 different types of the denture based material. Most commonly used are the heat cure acrylic denture base and the self cure one. So here it is informed that the acrylic teeth, the polymeric one, well, they bind more effectively with the heat cure acrylic denture base as compared to the self cure. In case there is a self cure acrylic denture base which is needed to be fabricated, well, for that, there are certain grooves, or you can say fissures, which are made at the backside of the acrylic teeth. You just make it yourself. Being an operator, being a lab technician, he has to make those grooves himself so that the self-cure acrylic interlocks between those holes and grooves. And he can also treat the base of the acrylic teeth with some sort of solvent so that it gets soft and easily adhere with the self cure one. For heat cure, you don't have to do it because already there is a good bonding between acrylic teeth and the heat cure acrylic denture base. Then coming to the coefficient of thermal expansion, a very important property of the artificial teeth. Well, acrylic teeth, they are more compatible with the denture base due to the similar coefficient of thermal expansion because they are chemically same. They both are chemically polymethyl methacrylate, right? So all the properties are going to be same. The coefficient of thermal expansion, the value is also going to be same for both the artificial acrylic teeth and the acrylic denture base. Whereas the crazing or the fracture lines are seen in case where the porcelain teeth, they are attached to the acrylic denture base, right? This is because of the difference of coefficient of thermal expansion, because here if we go back, here you can see the coefficient of thermal expansion of acrylic is 80 and that of the porcelain teeth is 7. So there's a huge difference between the coefficient of thermal expansion values. So just keeping this thing in mind, that having the same coefficient of thermal expansion means when the patient takes some hot or cold drink, any hot food, when the artificial teeth, it expands or contracts in the same way, in the same manner, the acrylic denture base will also expand or contract. So there is not going to be any difference between the values. Whereas in case of porcelain teeth, well, the difference is quite high, 80 and 7. That's a very big, huge difference. So acrylic denture base is going to expand or contract depending upon either hot or, let's suppose there is a hot environment or cold one. It is going to expand or contract because of its chemistry. Whereas the ceramics, well, they are not going to expand or contract like the acrylic ones. So there's always going to be difference, and that is the main reason for the fracture lines. Then the density, the porcelain teeth has density twice as high as compared to the acrylic teeth. Well, it means, what exactly does it mean? That the denture made from the porcelain teeth, they are going to be much more heavier as compared to the dentures having the acrylic artificial teeth. Because if we go back again, here you can see the density. Density is 1.2 for the acrylic and it is 2.4 for the porcelain. So it is double. So the density is double, the denture is going to be much more heavier, so there are much more chances for the maxillary denture to fall under the effect of gravity. So this is some big disadvantage related to the porcelain teeth. Then coming to the hardness, the porcelain teeth are harder as compared to the acrylic teeth. Well, they are going to be hard because, as I told you, the chemistry is different. The disadvantage in case of the porcelain teeth when adjustment is going to be required. Well, when the denture comes to you, you need to do it to insert it into the patient's mouth. You need to have some occlusal adjustment. And when the porcelain teeth, the problem is that they are so much harder that whenever you need to make certain occlusal adjustment, that becomes very much difficult because of the hardness of the porcelain teeth. That's why a lot of care is done while doing the tooth setup, so that there are little or very minimal chances of requirement of any of the occlusal adjustment at the time of insertion in case of the porcelain teeth. Whereas in case of the acrylic teeth, well, they are abrasive, so they can easily be grinded for the occlusal adjustment. So that's where the acrylic teeth, they stand out. The brittleness is also a very big problem with the porcelain teeth. They are hard, but they are brittle at the same time. So, well, the main problem with the porcelain teeth is that in case of if you do try to do some sort of the occlusal adjustment or something like that, it will easily chip off. The porcelain tooth is going to chip off, which is a big disadvantage because of its brittle nature. So, in that case, we have to replace the entire tooth again. So the porcelain teeth, the brittleness is a very big disadvantage. Then the forces on the soft tissues, well, as I indicated a couple of slides back, that the density of the porcelain teeth is twice as compared to that of the acrylic teeth. So the denture made from the porcelain teeth is always going to be heavy. So since it's going to be heavy, it is going to put much more larger forces on the underlying bone and the soft tissues as compared to the acrylic teeth. So what effect is it's going to do in long term, that due to constant application of such heavy forces, the underlying bone and soft tissue, well, the bone is going to, you can say, with the passage of time and this constant pressure, the bone is will start to resorb. It will start to resorb due to this large, heavy denture made up of porcelain teeth. Well, greater modulus of elasticity in this case of the, which is the main cause of the hardness. So this is going to be the main problem. The density is going to make the denture quite heavy, and so is the modulus of elasticity. Then lastly, if we compare the cost effectiveness of the both of the acrylic and the porcelain teeth, the acrylic teeth, they are much more cost effective as compared to the porcelain teeth. Uh, if we compare the price of both of these types of the uh, artificial teeth, well, acrylic teeth are much more cheaper and cost effective as compared to the porcelain teeth. They are very expensive, and not every patient can afford to have a denture made up of porcelain teeth. So that was a very short, brief, I would say, the review about the two different types of the artificial teeth, the acrylic teeth and the porcelain one. I hope it was helpful for you guys, and do leave your feedback in the comment section below. Do like and subscribe our YouTube channel, DentoScope Studio. Also, like and follow our Facebook page by following the link given in the description. And then you can also follow us on the Instagram for more updates. So that was today's lecture, and I will be very much thankful if you leave your feedback, and soon we will come up with more lectures on dental materials to make it easy for you all to understand. Well, I'm Dr. Rashid Hassan. Thank you for your time. Take care. Allah Hafiz.